Almost 1 in 4 adults in the United States, more than 26% of the population, has been diagnosed with a mental health disorder. Anxiety affects more than 40 million Americans. Nearly 10% of the US adult population has a mood disorder for which powerful drugs are being prescribed, which equates to about 30 million people on psychiatric medications. Depression affects 1 in 10 of us, and 1 in 4 women over the age of 40 suffers with depression. I'll say that again, 1 in 4 women over the age of 40 suffers with depression. These numbers are absolutely staggering, but they're also very concerning. And I think it's fair to say that despite all the different kinds of medications to treat mental health problems, these numbers keep increasing. And those that are taking medications like SSRIs and MAO inhibitors and tricyclic antidepressants often don't report much improvement. Many still suffer with anxiety and depression. These medications were the end-all be-all. You would just take the medication and you would feel good again. So what's happening here? What are we missing? Well, if you ask me, I think there's so much that we're missing when it comes to mental health. And I want you to stop just for a moment and I want you to ask yourself this question. This is a very, very important question that you ask yourself right now. In addition to your anxiety and depression, do you also suffer with digestive symptoms? Do you have gut problems, in other words? Okay, things like bloating, gas, constipation, diarrhea, abdominal pain. If your vitamin D levels were checked recently, were they also found to be low when your doctor tested them through blood work? And if you said yes, I want you to realize it's not a coincidence to have both depression, gut health problems like IBS and bacterial overgrowth, like inflammatory bowel disease, Crohn's and ulcerative colitis, and fat malabsorption, and have a vitamin D deficiency. I see this all the time in my clinic. Now, every single patient that basically undergoes or becomes a patient in my office undergoes vitamin D testing as part of my initial blood work panel. That's how important I think it is. And so while anxiety and depression have many root causes, and it would be impossible for me to really cover all of them in a video like this, I do want to bring to light the significant relationship that exists between mental health, vitamin D, and where these really intersect. And really those symptoms of abdominal pain, bloating, gas, constipation, keep in mind that those are symptoms, right? They're like a check engine light that comes on when you have a problem with your car, right? You can't ignore your body's warning signs without having consequences. Well, hey, I'm Dr. Hagmeyer, and I've got a great video lined up for you today. Today, I'm going to talk about things related to the gut health, related to the microbiome, vitamin D deficiency, the symptoms of a vitamin D deficiency, because I think all too often we just think that vitamin D is important for the health of our bones. But this is a huge understatement. Vitamin D activates over 200 different genes, including genes that influence the production of neurotransmitters, things that make us feel happy or things that make us feel anxious. I'll also talk about the connection between vitamin D and gut health, specifically how the microbiome is involved in mental health. And lastly, I'm going to go over where I like to see vitamin D levels for my patients that really just suffer with anxiety and depression. And I hope that you walk away from today's video with some encouragement. So let's jump into vitamin D and gut health. Well, when you think of vitamin D, I want you to start thinking about its role as it relates to gut health, right? Vitamin D and gut health really depend on one another. In other words, vitamin D is not only involved in mental health, it also plays a direct role in the health of your gut. And we know this through what's been studied and referred to as the brain-gut connection. Now, low vitamin D levels can directly cause digestive problems, and digestive problems can also directly cause or worsen vitamin D deficiency due to increased inflammation and vitamin D malabsorption. Now, you see, vitamin D, along with your other fat-soluble vitamins like A, E, and K, a common problem that we see with people who have SIBO and IBS and celiac and inflammation is fat malabsorption. Now, in people who suffer with fat malabsorption, the pancreas doesn't produce enough of an enzyme that helps break down and absorb fats. And when your pancreas fails to make enough of this enzyme, you don't absorb vitamin D and you develop a vitamin D deficiency. But that's not all. Vitamin D helps protect the gut by maintaining the gut lining, or what we call the gut barrier. And a breakdown in the gut barrier allows dangerous foreign particles to enter our bloodstream. Sometimes these foreign particles are bacterial toxins like xenobiotics. Sometimes they're endocrine disruptors. Sometimes they're undigested proteins. And these things all cause the immune system to spring into action. And when this barrier breaks down, we call it a leaky gut. And when the gut becomes more permeable or becomes more leaky, that inflammation can cause inflammation in the brain. And that's important for people who struggle with mental health problems. Leaky gut may be one of the underlying causes in illness involved in the disruption in what we call the blood-brain barrier. And numerous studies indicate that hypoxia, low oxygen, and inflammation increase blood-brain barrier permeability. Now, essentially, leaky gut equals a leaky brain. You should also know that a leaky gut has also been shown to cause type 1 diabetes, Crohn's disease, food allergies, skin conditions, and even autoimmune diseases like MS. So while vitamin D not only helps with leaky gut, it also helps strengthen and support that blood-brain barrier. You see, every tissue in your body has vitamin D receptors, and studies show that vitamin D can help prevent a leaky brain. That's important for inflammation purposes, and that's important for reducing the disruption of the blood-brain barrier. You see, vitamin D also increases the diversity of the microbiome, which is actually a really, really good thing. The greater the diversity in your gut microbiome, the better. Gut bacterial diversity plays a huge role in digestive function, in neurotransmitter production, in immune system regulation. You see, your microbiome and the diversity of this gut bacteria really have the ability to synthesize various B vitamins and vitamin K, but also neurotransmitters. Now think about that for just a moment. Bacteria in your gut can produce chemicals that influence happiness, depression, and anxiety. Remember, 80% of our immune system is in the gut. And so you may have heard that before. And I don't think it would be surprising for anyone by saying that improving the health of your gut microbiome, correcting any problems with leaky gut or bacterial overgrowth or fungal overgrowth or inflammation in your gut or gut dysbiosis can have a profound impact on your immune system. You see, in functional medicine, one of the most important areas that we focus in on for patients who have been diagnosed with an autoimmune disease is the gut microbiome, because we know how far-reaching the effects that a healthy microbiome involve, right? It was the Greek physician Hippocrates who said over 2,500 years ago that all disease begins in the gut. And I would say that was a pretty impressive prediction to be said that long ago. People who have problems with anxiety and panic disorders are put on medications called GABA agonists, and they're sometimes put on SSRIs. And these medications are designed or supposed to help improve anxiety and depression by improving or increasing GABA levels and serotonin levels. But according to a recent study in Nature, and again, I'll link this on my website in the description, 6 common antidepressants were tested for their antimicrobial activity against 12 typical human gut bacterial strains. And what they found that antidepressants either kill or stop the reproduction of many of the beneficial bacteria we need in our guts. Essentially, these medications, these antidepressants, are acting like antibiotics, killing off beneficial bacteria, killing off those gut bacteria, and altering the microbiome in a negative, adverse way. Now, it has to make you wonder if maybe part of the reasons people don't respond well to antidepressants comes from the antibiotic-like effects that they have on the gut microbiome. What might be some of the signs that you are struggling with vitamin D deficiency? Well, researchers found that the antimicrobial properties of many antidepressants act against the gut microbiome, causing reduced bacterial diversity, reduced bacterial abundance, reduced growth. Again, all of these things can have a wide, far-reaching impact on not only our physical health, but also our mental health. Now, in addition to depressive symptoms, there are several signs of a vitamin D deficiency that you should be on the lookout for, because vitamin D deficiency can cause things like mood changes, feelings of just feeling overwhelmed, hopelessness, sadness, fatigue, forgetfulness, loss of interest in activities that once upon a time sparked an excitement, enthusiasm, suicidal thoughts, anxiety, loss of appetite, weight loss, and trouble sleeping. Now, that's a lot of symptoms. Did you ever think that a vitamin D deficiency could cause all of those things? Well, if you experience any of these symptoms, obviously your vitamin D levels really should be checked. If you've been taking vitamin D and it's been over 6 months, you should get your vitamin D levels rechecked. If you have anxiety and depression or some other mental health problem and you've never had your vitamin D levels checked, guess what? It's time to get your vitamin D levels checked. That's how important I believe vitamin D level testing is when you have anxiety, depression, mental health issues, and gut problems, right? Getting these vitamin D levels tested is super easy. It's a simple blood test that can really be ordered anytime you have routine blood work done. And again, I check vitamin D levels on every single patient that I work with. It's just sometimes just a matter of checking off a box. And what I'll tell you is that almost every single one of my patients, if they're not supplementing with vitamin D, they have very low levels of vitamin D, or in those that are supplementing, those vitamin D levels are nowhere near the optimal range like they should be. Now, the last thing I want you to know really are some of the things that you can do to improve the health of your gut if you suffer with anxiety and depression. Number one is stop eating so much sugar, right? Eating less refined sugar, start eating more plant foods. Diets high in refined sugar and those laboratory, synthetic, man-made sugars, those all have a very, very adverse effect on our microbiomes. Number two is start fueling your microbiome with prebiotics and probiotics. Fiber is very important here because it feeds those good bacteria, which again, I think just has tremendous impact throughout the whole body. You know, in 2021, October issue of Molecule, basically it was a study that looked at prebiotics and probiotics and supplemental effects affecting the composition of microorganisms in the gut, which in turn was shown to be significantly improved when people ate more fiber. Polyphenols, these are plant compounds that have many, many health benefits, including reduction in blood pressure, reduction in inflammation, reduction in cholesterol levels, and reduced oxidative stress. Human cells really can't always digest polyphenols because they aren't always absorbed as efficiently. But polyphenols make their way to the colon where they're digested by our gut bacteria. Again, foods rich in polyphenols are going to be things like cocoa and dark chocolate, grape skins, green tea, almonds, onions, blueberries, broccoli. I actually did a whole video on it. You may want to check that out. But polyphenols increase the amount of bifidobacterium and lactobacilli in humans and reduce the quantity of Clostridia and other kinds of bacteria that have been shown to affect our mental health. So as I wrap up today's video, there's a few important things that I think are worth just reminding you about, reiterating. Number one is that vitamin D levels, depression, and the gut health, they're all connected. They're interconnected through what we call the brain-gut axis. And so when one is off, you're also going to find others to be affected as well. Vitamin D activates over 200 different genes. In the body and in the brain, vitamin D is needed to activate certain genes that are responsible for producing neurotransmitters like dopamine and serotonin. If you suffer from any mood or gut issue, get your vitamin D levels checked and check them regularly. When you look at vitamin D levels on your blood work, what you're going to want to see is you're going to notice that the range goes from 30 to 100 nanograms per milliliter. Ideally, I like to see vitamin D levels in the 60 to 70 nanograms per milliliter for people with anxiety and depression. Eating vitamin D containing foods, getting sunshine when possible, taking vitamin D supplementation, again, are all things that are part of the bigger picture in treating mental health issues. Probiotics and prebiotics, especially important for mental health and have been shown to help many people who suffer with depression and anxiety. Now, I'll leave a link for the different probiotic strains that have been shown to help with anxiety and depression, or maybe I'll even do a whole video on that particular topic. But again, like I said at the beginning of this video, and again, just worth reiterating again here, is that I believe if you're battling with anxiety and depression, every little thing that you do is one more step in the right direction. Everything you do when it comes to improving your health counts. And if you make enough base hits, do enough of the right things, eventually you start to bring those runs in and start to feel more stable mentally. And while there can be many causes of anxiety and depression, vitamin D and gut health are two important basic areas that I think need to be considered in everybody. Obviously, when I work with patients who suffer with mental health problems, there are some other areas of health that often benefit from testing. Things that I consider, in addition to neurotransmitters and gut health and vitamin D and other nutritional imbalances, maybe things like mitochondrial dysfunction. They might be like glutathione depletion and NRF2, NRF2. They might be the methylation pathways or genes involved in methylation, like COMT, MTR, MTHFR, and MTRR. I might consider things like oxidative stress and neuroinflammation. I might consider hormones and neuroplasticity. And finally, things like the sleep cycle. Well, if you enjoyed today's video, I hope that you'll come back, obviously, to my channel. If you have questions about today's video, drop those in the comment section below. If you have questions about working with my clinic and my functional medicine approach to anxiety and depression, you can obviously reach out to me by visiting my website, which again, I'll leave in the description box below. Again, if you like this video, here's another video related to gut health that I think you should check out.